Good afternoon, everybody. I'm Sayukta from Beautiful Spotless Skin team. I'm sure all of you must be keeping good health. To look beautiful and smart at all times is quest of humans right from the beginning of civilization. You all know proper skin protection is the best thing you can do for the health of your skin today and slow down the effects of aging tomorrow. In today's era, changing weather with excessive heat or humidity increases risk of damage due to UVA and UVB rays, which makes skin more prone to wrinkles, melasma, and skin cancer. We know that sunscreen is valuable from a skin cancer and sun damage perspective, as well as something that helps prevent fine lines and wrinkles. According to a survey, 67% of people in India are not using sunscreen as daily skincare routine. Several things about sunscreen that we people are not aware of, and that makes us not include sunscreen as an integral part of our skincare routine. So to keep you informed, today we are here to know about sunscreen in skincare routine. So let's connect today with our skin expert, Dr. Priya Agrawal, live from Himat Nagar, Gujarat. Dr. Priya Agrawal, MD, is a board certified doctor by Gujarat Medical Council. She is the co-founder of Priya Skin Clinic, Himat Nagar, Gujarat. She has extensive training in all aspects of dermatology, cosmetic dermatology, laser, and dermatologic surgeries. She believes in using advanced medical techniques to treat all her patients equally. Dr. Agrawal is a graduate of Gujarat Adani Institute of Medical Sciences, GAIMS, Bhuj, Gujarat, year 2010-2016, where she obtained her degree of MBBS. She then completed her dermatology residency at GMERS, Sola, Ahmedabad, Gujarat. Dr. Agrawal has also done extensive study of 3 years on atopic dermatitis. She has presented various papers and posters and has published various articles and has been awarded with the prestigious Dr. Bharat Shah Award for her award paper presentation. Recently, she became member of AAD, American Academy of Dermatology. Dr. Agrawal aims at providing quality service to the best of her knowledge and also care and compassion to all the individuals alike. Today, Dr. Priya will share with us on sunscreen and skincare routine. A very warm welcome to you, Dr. Priya. Hope you are doing good today.
Yes, I'm extremely good. Hope you are doing good too. And thanks for having me here.
Absolutely, and it's a pleasure to have you with us. Dr. As today we are going to talk about sunscreen and its importance. The very first thing I want to ask that people keep on saying that, you need sunscreen every day. But really, do we need to wear sunscreen every day?
See, what I this is my counter question to you. So, in our day-to-day routine lives, can you tell me one single moment where you're not stepping out of the house or where you are not in front of your screens? Let's say it can be a computer, a laptop, or your mobile screen. Is there any moment where you're not there in front of these things or you're not stepping out of the house?
I doubt. I mean, that's just not possible in today's time. Not at all.
So now I cannot find a single moment like that in my life. And to cope up with the lifestyle which we are having right now, like I can't ask anybody to just stay indoors. People are out there enjoying their lives, okay? And at the same time, you have to protect yourself from the scorching heat also. Like right now where I am, the temperature used to be 47 degrees, okay? Just few days back. So to how to bridge the gap between these two, you have to maintain the lifestyle, you have to protect your skin, so there has to be a screen, right? So that screen is provided by the sunscreen, so it is the bridge, you know. So it's
Okay. So we got you. I mean, there's the answer, that sunscreen is basically a guard, a safeguard, a jacket, you can say, from saving our skin from all the damages that the sun or the other light can have. So that means you want to say that it's just not the sun, but even if we are inside the mobile screen, laptop screen, they are equally harmful.
yeah, they are. Recently, if you like if you search online or if you are following the latest trends, then there is a buzz about this infrared radiations and the blue light. And so what is all this? So all this is because of the screen, the light which is getting emitted from the screens now. So like everybody's sitting on their laptops and making reels on Instagram, and so they're constantly in front of the screen. So the light which is getting emitted from there, that also leads to damage, some kind of damage to your skin. So yes, you need to protect your skin from that too.
Okay, so it's just not the sun, but from all the harmful rays that even the lights or our screens are emitting, we need to protect our skin. Now, the thing is, whenever we go to buy a sunscreen for our skin, there's one term, one abbreviation, I would rather say, SPF, which is like, what's that? And, you know, how to decide which SPF is good for me and which is not. Please elaborate that.
Okay, so basically now people have stopped using the word sunscreen and they're calling it SPF. So initially I was a little bit irritated with the fact that why it's a sunscreen. Okay, SPF is a measure. It's a measurement. Like like when we go in the market or हम लोग कुछ mango खरीद रहे हैं या हम लोग कुछ भी खरीद रहे हैं ना, anything we buy, so we have kgs and sort of those scales, you know. So this SPF is also a scale to know whether how much of your skin or how much quantity or how much time you can spend in the sun, so that you can measure with the SPF. So that is a sun protecting factor. Initially it used to be called sun protecting factor, but now they are considering it to call more of sunburn protecting factor. So what basically it means that suppose if you are not using any sunscreen and you are stepping out in the sun and your skin starts getting little bit of erythema, that is redness. Okay, so if your skin starts getting red in, let's say, 10 minutes. Okay, so that's the time. 10 minutes is the time which will cause you sunburn. Okay, now if you're using your sunscreen and the SPF is 30, okay, so that means कि आप उतना ज़्यादा time sun में रह सकते हैं without getting that redness. So that's how it's like SPF 30, SPF 70. So what does that basically mean? कि अगर आपका skin 10 minutes में red हो रहा है, तो अब आपको वो 30 times ज़्यादा protection देगा, 50 times ज़्यादा protection देगा. So that's how it's calculated. So that's SPF. What as SPF stands for the protecting factor.
Right. So SPF is basically sun protection factor, and that's how the 30, 40, 50 these levels of measurements differ. I would also like to know how to decide the right SPF for my skin.
See now, for different skin, it's different. Basically, different sunscreens are formulated for different skins. Okay, so first of all, you need to go to your dermatologist. We are there to help you knowing what skin type you have, and then depending on the skin type, depending on the condition which you are facing, okay, different SPFs can be there. But personally, what I'll say that always choose SPF which is above 30. That will give you decent protection. So yeah, I'll always choose a sunscreen which is at least 30 SPF above.
Okay, so 30 SPF above should be good for us. Now, another thing is, another thing is कि हम सब का exposure to sun और various light sources अलग-अलग होता है. हो सकता है मैं field में काम करती हूँ, मुझे बार-बार बाहर जाना पड़ता हो, scorching sun के अंदर में काम करना पड़ता हो. कुछ लोग हैं जो घर पे ज्यादा वक्त गुजारते हैं, लेकिन घर पे भी light के other sources हैं, जैसा कि आपने बताया कि उनसे जो rays emit हो रही हैं वो damage पहुंचा सकती है. कुछ है जो सिर्फ आधे घंटे ड्राइव करके ऑफिस जाते हैं एंड देन एक कंट्रोल्ड एटमॉस्फेयर में अपने ऑफिस में काम करते हैं. तो ऐसे में क्या सबके लिए एसपीएफ का लेवल भी अलग-अलग हो जाएगा?
See now, that's very interesting point that you pointed out कि कुछ लोग होते हैं जो सिर्फ आधे घंटे की ड्राइव करके ऑफिस में बैठ के काम कर रहे हैं. Now I face many patients, okay, so their question is, मैम हम क्यों सनस्क्रीन लगाएं, हम तो कार में जाते हैं. Now I have to ask them this question कि आप लोग क्या ब्लैक फिल्म लगा के कार में जाते हैं? Is it allowed? So no, it's not. क्या आप लोगों की कार विंडोज इतनी छोटी है कि अंदर धूप नहीं आ रही है? Because I don't have that car and I want to buy that car, you know. So they start laughing and I'm like, see, sunscreen आप ना अगर 1 मिनट के लिए भी धूप में जा रहे हैं तो over the period of time it becomes cumulative and you will not know when you'll start aging, you know. So I don't understand. अगर आप 30 minutes में drive करके पहुंच रहे हैं, so just imagine car already heated up है, so that infrared radiation which we were talking about earlier, so that heat and then the sun rays which are coming inside, and though a certain amount of protection will be provided by the window glasses are not tinted that much, so it will give you protection of only 2 to 5 SPF, not more. So I don't think that whether you are in the car or inside your office, inside in your office, if you are working on your laptop screens, then the blue light which you are talking about. So anywhere if you go, it becomes really, sometimes it becomes difficult to convince the patients. But sitting here at Himat Nagar, I realize one thing, that patients here are ready to accept the fact कि नहीं हमें sunscreen use करना चाहिए, and they see the difference. So if it is possible in Himat Nagar, it's a very small town, you know. So if it's possible here, I feel people all over the world can do it. I can feel the change happening.
I can completely agree with you. And frankly speaking, summers में कार जो है ऐसा लगता है जैसे माइक्रोवेव oven हो गया है, वो हम bake हो जाएंगे कार के अंदर. So definitely, even if you are driving in a car for 15 minutes, please use sunscreen. No way out, no excuse for not using sunscreen. I don't understand another thing, doctor, that as I said earlier during the introduction part, that 67% of people in India have all the excuses for not using sunscreen, despite knowing the fact that we stay in a tropical condition, the sun is really bad most of the time, or otherwise other light sources are there definitely. Why we have all the excuses for not using sunscreen?
I think people feel that sunscreen, first thing is sunscreen, when you apply sunscreen, उससे थोड़ा सा आपको heating effect आएगा. So that is the property of few of the sunscreens. They will work like that. वो energy absorb करके उसको heat में convert करेंगे, and that's how they become activated. Okay, so it is that basic mechanism, उसकी वजह से वो heat लग रही है. And then few of the sunscreen can lead to acneiform eruptions, but those people who already have acneiform eruptions, उनके लिए अलग sunscreen formulate हुए हैं. So they don't have knowledge. They feel कि हमें कुछ भी extra layer लगाने से हमारा skin और गंदा हो जाएगा. We'll have more spots, we'll have more acne. हम लोग बहुत गंदे दिखेंगे. The white cast will be there. So there are many myths regarding sunscreen. So I think that if by doing this lecture also, you might be spreading awareness around regarding sunscreen. So it might bring change.
That's the whole purpose of conducting this session, and we are hopeful that people, after listening to this session, will actually go and buy a sunscreen for them if they are not using it yet. One more thing regarding the application of sunscreen, how much to apply. Somebody will say that just a peanut of sunscreen or one trans of finger, or we need to reapply, and how many times to reapply? These are the questions that we would like you to answer.
Okay. So what the book picture says, it is 2 milligram per centimeter square. Okay. So now it's very difficult to understand. So if we go by the teaspoon rule, so it's like if you apply sunscreen on your face and neck, you require a little bit more than 1 teaspoon. Okay. Half of teaspoon, I'll say. Half teaspoon से थोड़ा सा ज़्यादा ले लो, वो पूरे face और neck को cover कर लेगा. If you're taking half teaspoon, तो वो पूरा arm को cover कर लेगा. Okay, that's one arm. So you will require one here. ठीक है? If you're taking 1 teaspoon full, then it will be covering your front, your back, another one for your one leg, another one for the other part. So it's like 3 ml, 6 ml quantity आपको लेना है on an average. 3 ml for the face, neck, and each of the arms, and 6 ml for the legs and the chest back part.
Okay. And do we need to keep on reapplying sunscreen?
See, yes, actually it is recommended that you do apply sunscreen every 2 to 3 hourly. Why so? Because we live in tropical climate, as you said, right? Sweating hoga, people will want to wash their face. ठीक है? आपको लगेगा कि नहीं अभी, like obviously sunscreen will provide some kind of heat to your face. You are stepping out, you are sweating, so you are going to ruin. So you can apply it after every 2 hours, even if you are in the protected environment in your AC chambers, you can still apply it after 2 hours or 3 hours probably. Yes, you can.
Right. So we can reapply and we should reapply. That's the way. How is the effectiveness of sunscreens are measured? You know, how effective that sunscreen is going to be for my skin.
See, like I said, there are various measurements available. So, like we talked about the SPFs earlier. So that is one of the measures which will show you आपको कितना protection मिलेगा from the sun rays. Then there are certain kind of ratings, boot star rating, ये वो जो आप आपके sunscreen पे stars देखते हैं. So even those stars, if it is 3+, then it is a very good sunscreen. Sometimes they also label it as a water resistant sunscreen or sweat proof sunscreens. So these are different measures, like they measure the substantivity. Basically, what is substantivity? If suppose you are a swimmer, okay, if you are going in swimming pool, or if you're an athlete, whatever, so when you apply sunscreen, so they measure the substantivity, that is the water resistance, kitna wo water resistant hai, whether it is very water resistant or just water resistant. So अगर कोई sunscreen है वो 40 minutes तक आप लगा मतलब पानी में हो फिर भी उसका effect रहेगा, so that is its substantivity. Okay, so that is also one of the measures. So कुछ लोगों को sweat proof देना पड़ता है considering their jobs. So yes.
Yes, definitely. कुछ एथलीट्स होते हैं वो बहुत भागते हैं, जिमनास्ट होते हैं, बहुत स्वेट आउट करते हैं, तो डेफिनेटली दे नीड समथिंग लाइक दैट. डॉक्टर, द थिंग इज, जैसा आपने भी पॉइंट आउट किया कि कुछ लोगों को लगता है कि सनस्क्रीन लगाओ तो बहुत ज्यादा स्वेटिंग होती है, कुछ को लगता है कि एक्ने होने लगते हैं, बहुत पसीना आता है, बहुत ऑयली होता है. तो उसमें भी आपने कहा कि इसका मतलब है कि आप अपनी स्किन, सही स्किन टाइप के हिसाब से सनस्क्रीन चूज नहीं कर रहे हैं. बहुत सारे फॉर्मुलेशन अब अवेलेबल है. We have spray sunscreen, we have gel based sunscreen, etc etc. हम अपनी स्किन टाइप के हिसाब से बेस्ट सनस्क्रीन कैसे चूज कर सकते हैं?
So see, you have more of an oily skin, okay? If you have oily skin, so acne prone skin है, oily skin है, go for gel based sunscreens. Okay, they are the best. मतलब वो आपको उतना sticky नहीं लगेगा. They have that formulation, that base is such कि आपको उतना oily नहीं लगेगा. You will not even sweat more. Okay. Now, if you have a very sensitive skin, बहुत लोगों को ऐसा होता है कि if they have sensitive skin and if you give them organic sunscreens, then that will cause havoc in their minds, so they have to go for physical sunscreens. And then if you are like already having some other dermatosis of the skin and you apply your sunscreen, whatever sunscreen you have chosen, that can also lead to irritation. So different formulations, like you very well said, there are spray forms, lotions, gels, creams. So different formulations for every kind of indication is there. But the spray form particularly, I do not prescribe much, because then it will not cover the area evenly, though you might need sometimes to cover entire or something. In movies they show the actors are doing like this pure mein spray karta sunscreen, but it will not give you even coverage. So I personally don't prescribe spray sunscreens, but then rest of the sunscreens are a very good yes.
Yeah, the best part is that there are so many sunscreen and different formulations are available now, and you can choose the best one as per your skin type or your skin requirement. One more thing, doctor, kids also go out under the sun. Even if they are inside, then a lot of light exposure is there. So do we need sunscreen for children as well?
Yeah, they can go for, see, less than 6 month old infants, I don't prescribe sunscreens, they don't need it. Okay, but if they are more than 6 months, 1 year, koi swimming karne ja raha hai, and if their parents are insisting that please prescribe some kind of sunscreen, so their sunscreen is not different than the adults. But yes, I always prefer physical sunscreens for children who actually require sunscreen, you know. But most of the times I tell them that it's their age to play out in the sun. Don't just bother them with good skincare regime right now. So yes, you can give them skin sunscreens for their activities, physical ones. Yes.
Okay, so no harm if 6 month plus, kids
Yes. No.
are using sunscreen. Fair enough. Another thing is that a lot of people use coverings like hat, cap, or a scarf to cover their face when they are going out in sun, saying that as I'm already protecting myself for the clothing, I don't need sunscreen. Do these clothes, part of pieces of clothes also have SPF factor? I mean, if I can say that, or despite those coverings, it's essential to use sunscreen?
That's a very good which you raised now, the clothing material, na, they also have a certain kind of labeling, which is labeled as UPF. Okay, so if the UPF, that is the cloth protecting factor from the ultraviolet rays. Okay, so if the material is heavily knitted, or if it is a nylon polyester material, the color is dark, and they use certain dyes which also has this property of sun protection, then they calculate the UPF, and if it is more than 50, okay, so that is the best material which will protect you from the sun rays. Okay, so UPF is also a very good factor. So what I want to say कि अगर आप कोई खाना बना रहे हैं और आप कंबाइंड अप्रोच बना रहे हैं कि आप दाल के साथ चावल भी बनाएंगे, आप सब्जी के साथ रोटी भी बनाएंगे, तो वो फुल प्लेट लगता है ना. So if you apply a sunscreen and if you also wear a 4-inch का broad brim hat, आपने उसको cover भी किया है, so it is a combined approach. You are actually making your skin look younger, and like the page itself says, spotless skin. So yeah, you'll make your skin spotless. So yes.
So with cloth coverings or not, I mean, they are good, but then please use sunscreen. I mean, there's no way out, no. Sunscreen. So sunscreen is essential for your skin. One more thing, doctor. I mean, we often wonder what should be the chronology of, our skin care routine. We all know that we need a good face wash, moisturizer, but with sunscreen, which part should we fit the sunscreen? I mean, soon after the face washing or cleansing part, or before moisturizing, or after moisturizing? That's also a doubt. Please clear that.
Has to be the last resort if you are not going to apply any kind of makeup. Okay, so do whatever you want to. You wash your face, you apply a moisturizer, you can use a toner, any kind of serums if you are using, like I use hyaluronic acid on my skin, then I apply moisturizer. Okay, and the last part which I apply on my skin is the sunscreen. So if I'm not going in a party, so sunscreen is my makeup, and if I'm going to a party, then yes, I can apply makeup over my sunscreen.
Okay. So yeah, so makeup over sunscreen can be applied. And in case we need to reapply sunscreen, for example, I'm going out during the day and it's maybe an open wedding ceremony, anything, I mean, under the sun, then I'll try to reapply the sunscreen over my makeup. Is it possible again?
No, that's quite not possible. You won't want to ruin your makeup. You don't want to ruin your mascara. So there are certain sunscreens which the companies claim that they can give you protection for longer period. Like let's say 6 hours, even up to 12 hours, the companies are claiming there are certain sunscreens like that. So you can go for those sunscreens also.
Right. And there are, again, makeup products saying that they have some sun protection factor. We can go for those.
Yes. Normally your foundation gives you a protection of 5 SPF. Okay, so obviously that's not enough, but already you have a sunscreen base under your foundation. So over that, if you're applying certain kind of makeup, so that somehow it gives you a good coverage also. And see, I don't personally believe कि moisturizer के अंदर sunscreen भी add कर दिया, so now it's okay, because the basic concept of moisturizer is you need to apply it 12 hourly or 10 hourly. Okay, and sunscreen को आपको और frequently apply करना है. Now if you are mixing both, I don't know, I won't apply moisturizer every 2 hourly. I won't do that. So no, keep your moisturizers different, keep your sunscreens different. Let everybody be happy na at the end.
Right. So, I mean, that's the bottom line, sunscreen is an essential part of our skincare routine. Thus, and plus, as we need to reapply sunscreen, please keep a separate sunscreen for yourself. That's really important. And the SPF factor, again, as per your, exposure or your working conditions, etc. And the formulation as per your skin type. Many a times, I'm sure people come to you and say, that they don't like using sunscreen because it makes them dark, it makes them patchy, the white casting, etc., etc. What do you tell them? I mean, how bad can not using sunscreen be to our skin?
See, people don't know that aging also comes from sun exposure. Okay, सो ग्रेजुअल क्यूमुलेटिव एक्सपोजर जब भी होगा तो हमारा स्किन का जो कोलेजन इलास्टिन है विच कीप्स द स्किन टाइट, इट कीप्स द स्किन टॉट, सो बिकॉज ऑफ द सन एक्सपोजर धीरे धीरे वो डैमेज होता है। तो आपको अगर चाहिए कि मैं थोड़ा और यंग दिखूं, मैं भी कियारा अडवाणी लगूं, मैं भी आलिया भट्ट लगूं, सो यूज सनस्क्रीन्स, यूज मॉइस्चराइजर्स, इट इज वेरी मच नेसेसरी for using those. Otherwise you will end up having early aging, you will have melasma, you will have freckles, you will have what not, your skin won't be spotless.
Right. We'll also pick some of our viewers' questions. We have Ashita Jain asking, if I wear sunscreen often, can I get a vitamin D deficiency? That's another thing that people, keep on complaining.
So hi, I don't know from where you are watching me right now, but let me tell you one thing. Indian skin na, we have skin type 4 and 5 basically. So हम लोगों की skin को अगर आप हफ्ते में 2 या 3 बार just for few minutes if you expose your one arm also, that is also enough for vitamin D synthesis. Okay, so and you're not going to cover your entire body with sunscreen. कहीं ना कहीं तो पैर ऐसा बाहर निकल रहा होगा, it will be peeping out in the sun. So don't worry, you will not have vitamin D deficiency.
और सनस्क्रीन मोस्टली जैसा कि डॉक्टर ने कहा हम चेहरे पे लगाते हैं, रेस्ट ऑफ द बॉडी मोस्टली वो विटामिन डी अब्सॉर्ब कर ही लेगी एंड इट विल वोंट हैम्पर योर विटामिन डी अब्सॉर्प्शन ऑफ योर बॉडी। प्रिया शर्मा इज हियर आस्किंग, मैम सनस्क्रीन के कोई साइड इफेक्ट्स भी होते हैं क्या?
हो सकते हैं कि साइड इफेक्ट्स बेसिकली क्या है कि if you do not choose a right sunscreen for your skin, okay, then that can lead to side effect, or if some of the components which are already present in your sunscreen and they do not suit you, then it can lead to certain side effects. अभी आपने सनस्क्रीन लगाया और आपकी स्किन को वो सूट ही नहीं हुआ, वो आंख में भी चला गया, सो इट कैन कॉज लिटिल बिट ऑफ इरिटेशन, एलर्जी, डिपेंडिंग ऑन व्हाट स्किन यू हैव. चूज योर सनस्क्रीन वेरी वाइजली, जस्ट कॉन्टैक्ट एनी नियर बाय डर्मेटोलॉजिस्ट एंड आस्क आपका स्किन टाइप क्या है, आपकी स्किन को कौन सा सनस्क्रीन विल बी द बेस्ट, व्हाट आर योर वर्किंग आवर्स, जस्ट से एवरीथिंग इन डिटेल एंड गेट अ गुड प्रिस्क्रिप्शन फॉर योर स्किन.
Right. Shubh Maran is here. What is the difference between physical and chemical sunscreen?
ओके, सो सी जो कुछ लोगों को लगता है ना कि हम सनस्क्रीन लगाते हैं तो एक व्हाइट कास्ट फेस पे आता है, व्हाइट एक लेयर सा लगता है. सो दोज सनस्क्रीन्स बेसिकली आर फिजिकल सनस्क्रीन्स, देयर मैकेनिज्म इज जस्ट बाय रिफ्लेक्शन ऑफ द सनलाइट, तो वो व्हाइट कास्ट एक देगा, बट दोज आर वेरी इनर्ट, very stable and ideal sunscreens. But because you don't want that white cast and you don't want to look like a ghost, so chemical sunscreens are there, which when you apply to wo absorb ho jate hain, and they don't give that white cast, they will just absorb the light on your skin that will give you certain kind of heat, jo wo aapko garmahat feel hoti hai. Those sunscreens are chemical sunscreens.
आई थिंक फिजिकल सनस्क्रीन वो है जो हम कई बार देखते हैं स्पोर्ट्स में, क्रिकेट में, प्लेयर में वाइट कास्टिंग होता है ना के ऊपर, दैट्स द फिजिकल वन. विजेता मोदी इज हियर आस्किंग, मैम व्हाट इज PF++++? वी हैव सीन दिस ओवर सनस्क्रीन बॉटल्स मोस्ट ऑफ द टाइम.
Talking earlier, वो जो आप stars देखते हैं या वो आप plus signs जो देखते हैं, those are all Japanese and European or Australian, New Zealand methods of measuring whether your sunscreen will protect you against the UVA. See, sun has this different amount of rays, UVC, B, A, okay. तो हमारा जो sunscreen है वो उसके जो SPF है या जो plus signs है या जो stars है, वो ये determine करते हैं कि आपको आपका sunscreen UVB से बचाएगा, A से बचाएगा, infrared से बचाएगा, thermal energy से बचाएगा, all kinds of, so whether it is broad spectrum or not, you will get an idea of that. So it's just the measure which the other countries are using, okay, this measure plus, 3+ is good, 4+ is very good, like that.
ओके, आपने अभी मेंशन किया ब्रॉड स्पेक्ट्रम. जब भी हम सनस्क्रीन लेने जाते हैं बहुत सारी चीजें उस पे होती हैं अपार्ट फ्रॉम SPF लेवल, और उसमें एक चीज ब्रॉड स्पेक्ट्रम होता है. देन देयर आर वेरियस थिंग दैट विल गिव यू प्रोटेक्शन फ्रॉम UVA, UVB. कुछ में लिखा होता है ब्लू लाइट एंड इंफ्रारेड लाइट से भी वो आपको प्रोटेक्शन देगा. तो किन फॉर्मुलेशन, क्या क्या चीजें उसमें होना चाहिए जो हम एटलीस्ट कवर देख के ही समझ जाए कि ओके दिस इज गुड फॉर.
See, mostly now, what you will see in the sunscreens is they'll write entire list: UVB, UVA, infrared, blue light, PA+++, SPF 50+. So if this is the I'll say the Marilyn Monroe checklist. If all this is present, okay, it's perfect. But I'll say, don't fall in the marketing gimmicks. Okay, just go for dermatologically prescribed sunscreen according to your skin type. If you need SPF 30, go for SPF 30. If you need SPF 50, go for SPF 50. Don't just randomly rush into the trends and buy each and everything, because it's trending, I should have it.
Right, I completely can, understand what you're saying. स्पेशली मतलब ये जरूरी हम सबके लिए कि हम एक बार डर्मेटोलॉजिस्ट के पास जाए, क्योंकि सनस्क्रीन हमें रोज यूज करना है, एक दिन में एक बार से ज्यादा बार यूज करना है, तो एटलीस्ट वो हमारे स्किन के रिक्वायरमेंट, स्किन के टाइप के अकॉर्डिंग होना चाहिए. तो प्लीज गो एंड चेक विद योर डर्मेटोलॉजिस्ट फॉर वंस. वो जो आपको प्रिस्क्राइब करके देते हैं वो आप यूज कीजिए, रेगुलरली यूज कीजिए. हमारे पास सोनिया सिंह है, पूछ रही हैं, डू आई नीड टू कंटिन्यू टू वेयर सनस्क्रीन आफ्टर आई गेट अ टैन?
After I get what? I'm sorry?
Tan. Her skin is getting tanned.
Yeah. Absolutely. Why would you want your skin to get tanned more by not using sunscreen? Absolutely, yes.
इसका मतलब कि शायद अभी तक वो सनस्क्रीन यूज नहीं कर रही थी, लेकिन जब टैन हो गई है स्किन, नाउ शी इज वंडरिंग वेदर शी शुड गो फॉर अ सनस्क्रीन. डेफिनेटली यू शुड. Rohit Ranglani is here asking, I'm a working person, how can we reapply sunscreen every 2 hours? Sunscreen spray are launched, can we use them for outside use also?
See, Rachit, right? Rohit, okay. Rohit, like I previously said, agar aap spray forms are available, and I'm not that big a fan of spray forms because they will not cover your skin evenly, okay? अगर आप लोशन लेंगे या आप क्रीम बेस लेंगे, so you can rub it evenly by your own hands. आप स्प्रे से ऐसे स्प्रे करके छोड़ देंगे, it will not cover your skin entirely, so you will have patches of tanning somewhere. And if you're in your office space, like I said, there are certain companies which are giving sunscreens which will give you longer protection. And if you're in your office, then you can apply sunscreen after 3-4 hours. That's okay. You can wash your face, washroom mein jao, wash karo, fir se apply kar lo. Because I think you might be working in your office in front of your laptops. So yes, you need certain kind of protection, and it's not that hard to reapply a sunscreen.
Yes, I mean many a times we take break and go and wash our face. तो जितनी बार हम अपना face wash करते हैं या छोटा सा break लेते हैं, उसमें उतना ही time लगता है sunscreen apply करने में भी. So it's not that difficult.
Such a small cream, it's such a small tube. You can keep it anywhere. In your laptop bag also it will fit.
Completely true. And doctor, there are so many products जो marketing gimmick जैसे हम कहते हैं, रोज इतना कुछ है, इतने कुछ advertisements आ रहे हैं, natural extracts है, किसी में कुछ है, और हमको नहीं पता कि इसमें से क्या क्या हमारे लिए, हम एक तरह से ना बिल्कुल चकाचौंध में खो से जाते हैं कि कौन सा पिक कर ले हमारे लिए. We end up buying a lot of products for our skin. We end up buying a lot of sunscreens अलग अलग टाइप के, और अब समझ में नहीं आता इसमें से क्या वर्क करने वाला है. तो क्या करना चाहिए? जो मार्केटिंग गिमिक है इसको अपने ऊपर हावी होने दे?
नहीं, बिल्कुल भी नहीं. सी, आई विल टेल यू, अगर आपको ऐसा कि घर से ऐसा क्या हम लोग कंज्यूम करें या ऐसा हम क्या कर सकते हैं एडिशनल टू अप्लाइंग अ सनस्क्रीन व्हिच विल गिव अ सिस्टमिक प्रोटेक्शन आल्सो. सो देयर आर oral sunscreens also which are available, and also you can have your green tea. Okay, green tea is again very good as an antioxidant, and it will also give you protection from the sun. Also you can take vitamin C. So all these tablets या फिर ये in the form of amla or in the form of lemon juice, anything you can have it. ये सब चीजें करिए ना, घर में भी तो है अवेलेबल. उसके लिए मार्केटिंग गिमिक्स में फॉलो करने की कोई जरूरत ही नहीं.
Yeah, definitely. I think आप यही कहना चाह रहे हो कि अगर आप उससे जैसा वो है उस फॉर्म में अगर इनटेक करते हैं, खाते हैं, तो वो भी आपको बहुत हेल्प करेगा, rather than going by the marketing gimmick. इसमें इसका एक्सट्रैक्ट है, इसमें ग्रीन टी एक्सट्रैक्ट है, या इसमें एलोवेरा एक्सट्रैक्ट है. उससे बेटर है कि डर्मेटोलॉजिस्ट से मिले अपने बेस्ट सनस्क्रीन के लिए. डॉक्टर, वन मोर थिंग, सनस्क्रीन बहुत तरह के होते हैं, और एक मेडिकेटेड सनस्क्रीन होता है डेफिनेटली, और एक जो अलग अलग ब्रांड्स होती हैं वो अपने अपने सनस्क्रीन लॉन्च करती है. हमारे लिए क्या बेस्ट?
Because personally I use only the medicated ones, and I've never used sunscreens which are available outside as such. I use sunscreen which is suitable for my skin type, and I know my skin type. So I'll say that just get to know your skin type first. And you can choose whatever sunscreen suits you. Like many patients come and tell me, ma'am, we are using this ABC brand or XYZ brand, or we are using this and it is suiting me. So then I don't tell them to stop using it, because what I want from my patients is, okay, I just want their adherence कि नहीं हम लोग use करेंगे. So I tell them, okay, use whatever is comfortable to you, and I just check the parameters. I just check everything which they have, and sometimes I do change it because I know if they keep on using this for long, it's not going to benefit them. So I function like this. If I have to change, I will change. If I do not wish to, I will not. So I think you should also go and check with your dermatologist if they function like how I do.
That's the best way out, because your dermatologist will be able to tell you what your skin type is, what will actually suit you, what will not. Sakshi Verma is here asking, what type of sunscreen should I put on my kids?
Yeah, you should go for physical sunscreens. If your kids are out there playing in the sun, or having a swimming class or a horse riding class or whatever, so you go for physical, because see, I said it earlier also, those sunscreens will not cause any harm. They are very inert. They are allergenic. They will not cause any kind of harm. It's just that they will leave white cast. तो वो whiteness जो रहेगा ना, वो ही एक problem है. But it's the best. आप kids के लिए एकदम safely use कर सकते हैं.
अच्छा, एक और कंसर्न जो लोगों को होता है वो ये कि हमारी स्किन बहुत डेलिकेट है, हमारी स्किन बहुत सेंसिटिव है, सेंसिटिव स्किन के केसेस बहुत बढ़ गए हैं, वो क्या करे, स्पेशली सनस्क्रीन के मामले में?
Go for gel based sunscreens. Go for gel based. And see, one more thing, I don't know, every now and then patient comes, rushes to the OPD and say, मैडम मेरी स्किन बहुत सेंसिटिव है, प्लीज मुझे कोई हेवी डोज मत देना, प्लीज मुझे कोई ऐसा क्रीम मत देना जिससे मुझे रिएक्शन है. नाउ आई वांट टू अंडरस्टैंड व्हाट अ सेंसिटिव स्किन मींस. मेरी लैंग्वेज में सेंसिटिविटी इज इफ यू अप्लाई कुछ ना तो रेडनेस होगा या फिर सूजन होगा या कुछ तो होगा ना. दे गो टू ब्यूटी पार्लर, दे डू समथिंग एंड दे फाइंड आउट कि नहीं उनका स्किन सेंसिटिव है क्योंकि ब्यूटी पार्लर वाला का कुछ सेट नहीं हुआ. सो दैट्स नॉट द थिंग. ओके, सेंसिटिविटी इज व्हाट, अगर आपने कोई सनस्क्रीन लगाया एंड इफ यू हैव रेडनेस, इफ यू हैव दैट सूजन जो मैंने बोला, ऐसा कुछ होता है, तो उसका हम लोग पैच टेस्ट करते हैं. वो आप भी कर सकते हो घर पे. जस्ट अप्लाई द सेम सनस्क्रीन ऑन द बैक ऑफ योर ईयर और ऑन योर फोर आर्म्स. टेस्ट इट. अगर आपको एलर्जी है ना तो इधर भी दिखेगा. If you're not allergic, then don't discard the sunscreen. Don't panic. उसमें पैनिक मोड में नहीं आना है. Don't just simply label your skin as sensitive. Just see whether actually you're reactive to that particular sunscreen or not. Ask your doctor, and if they can help you out, like then I can. If you're really allergic or if you have really sensitive skin, then gel-based sunscreens हम apply कर सकते हैं very safely. It is now made for such type of skins.
राइट. सो हम ये जज करने में कई बार गलती कर सकते हैं कि हमारी स्किन सेंसिटिव है या नहीं. इसके लिए बेटर है कि हम अगेन डर्मेटोलॉजिस्ट के पास जाए, वो ही हमें गाइड करेंगे. इसीलिए हम बार बार कह रहे हैं कि प्लीज गो एंड चेक विद योर डर्मेटोलॉजिस्ट बिफोर यू गो एंड बाय अ सनस्क्रीन फॉर यू, सो दैट फॉर वंस एटलीस्ट यू नो कि आपका स्किन टाइप क्या है, आपकी स्किन सेंसिटिव है या नहीं, कोई और इशू है तो वो भी एड्रेस हो जाएगा. बिपिन पटेल हमारे साथ है. डॉक्टर प्रिया पूछ रहे हैं, एक्ने प्रोन स्किन के लिए sunscreen application is very difficult because application is not good. I mean, compliance is not good. So what do you recommend?
There are now sunscreens which are there for even acne prone skin. Okay, now I understand कि अगर आप लगा रहे हैं तो थोड़ा सा pain, if the acne is painful, So if even applying the topical ointments for the acne is also sometimes painful, I totally understand. But few days later, जब आपका वो therapy जो चल रहा है and your acne starts subsiding, at that point you can at least introduce your sunscreens. If initially it becomes very difficult for you to start, gradually जैसे आपका acne subside हो रहा है ना, you can introduce your sunscreens. And why it is very important at that point of time? Because see, your acne is causing inflammation in your skin. ठीक है, अंदर से skin inflamed होगा, जैसे ही वो healing phase में आएगा ना, it will leave certain kind of पिगमेंटेशन ऑन योर स्किन. सो अगर आप उस स्टेप पे सनस्क्रीन इंट्रोड्यूस नहीं कर रहे हो तो वो PIH जो हम बोलते हैं, दैट इज द पिगमेंटेशन, काला दाग, वो बढ़ता ही जाने वाला है. और बाद में जब आप कंसल्ट करोगे तो आपकी रेजिमेन में कहीं ना कहीं सनस्क्रीन तो फिर से आने ही वाला है. ठीक है, तो व्हेन योर एक्ने इज लाइक गोइंग डाउन, you start using your sunscreens to avoid having or to minimize the pigmentation which you are going to have later on.
राइट, तो इसलिए और ज्यादा इंपॉर्टेंट हो जाता है अगर एक्ने है तो एटलीस्ट वो जो एक स्कार छोड़ के जाता है वो ना जाए. इसके लिए जरूरी है कि जब वो सबसाइड हो रहे हो तब से तो एटलीस्ट आप सनस्क्रीन यूज करना शुरू ही कर दे. मैं ये भी आपसे डॉक्टर पूछना चाहूंगी, सनस्क्रीन को लेकर बहुत सारी चीजें हैं जो लोगों के दिमाग में रहती है, बहुत सारे बैरियर्स हैं जिनको तोड़ना बहुत जरूरी है. सही सनस्क्रीन यूज करें ये भी बहुत जरूरी है. तो जनरली आपके पास जब पेशेंट्स आते हैं तो आप उन्हें क्या सजेस्ट करते हैं, क्या बोलते हैं?
See, I first of all, मेरे पास जो पेशेंट्स आते हैं उनको कोई ना कोई दूसरा स्किन कंडीशन जनरली होता है. Either they have acne, either they have very oily skin, or they have some kind of melasma over there, or they have freckles, lentigens. So I always use the combined approach. I treat the underlying skin condition, I prescribe the right sunscreen according to their skin type, and I also counsel them for wearing shades. उनको sunglasses भी पहनना है. They have to cover their face, they have to cover their also in order to protect your skin and your neck. So I always go with the combined approach. Use your sunscreens and also use your physical protection. Both combined.
राइट. और अभी आपने जिक्र किया मुलाजमा का. बहुत आम लोग जैसे पिगमेंटेशन के तौर पे जानते हैं, लेमन जो है पिगमेंटेशन समझते हैं, और बहुत कॉमन प्रॉब्लम स्पेशली इन वुमेन इन इंडिया. तो ऐसे में अगर पिगमेंटेशन है या नहीं चाहते हैं कि पिगमेंटेशन हो, उसमें भी सनस्क्रीन का इंपॉर्टेंट रोल है.
I will say कि ऐसी कंडीशन में you can't work without sunscreen. You just can't breathe without sunscreen. If you have melasma, if you have pigmentation, a sunscreen is must because it's simple. आपकी स्किन स्पॉट है, आप धूप में गए, आप टैन होकर आ गए, ठीक है, आपकी स्किन पे ऑलरेडी पिगमेंटेशन है, तो आप सोचो आप धूप में जाओगे तो क्या होगा.
राइट. तो इसलिए बहुत जरूरी हो जाता है, खासकर जिनको ऑलरेडी पिगमेंटेशन फ्रेकल्स दिखने लग गए. प्लीज अगर अभी तक स्टार्ट नहीं किया, स्टार्ट यूजिंग सनस्क्रीन. इट्स द हाई टाइम. वन मोर थिंग इज, कई बार कहते हैं कि बाहर अगर आप जा रहे हो उससे थोड़ा पहले सनस्क्रीन अप्लाई करो. और कई बार एक टेंडेंसी होती है कि हमने सनस्क्रीन अप्लाई किया, हमको स्वेट हुआ और हमने एक वाइप से या हैंकरचिफ से अपने स्वेट को वाइप ऑफ कर लिया. पॉसिबिलिटी है कि उसके साथ हमारा जो सनस्क्रीन है वो भी वाइप आउट हो गया. क्या करना चाहिए?
A very necessary, very important question you have asked here. आपको सनस्क्रीन कितने टाइम पहले लगाना चाहिए? So I advise my patients to apply sunscreen 30 minutes before stepping out of the sun, and then repeat it every 3 hourly or 6 hourly, depending on what sunscreen I'm prescribing. So yes, you have to sunscreen 30 minutes before stepping out of the sun. उतना टाइम उसे skin होने के लिए, एक्टिव होने के लिए चाहिए ही चाहिए. सो डोंट फील कि अभी फटाफट लगा के आई विल स्टेप आउट इन द सन एंड देन डोंट गो रनिंग टू योर डर्मेटोलॉजिस्ट कि मैं तो सनस्क्रीन लगा रहा हूँ तो भी मैं काला हो गया. यू नीड 30 मिनट्स बिफोर, इट टेक्स दैट मच टाइम.
राइट. तो ये भी जरूरी है. पलक सेन पूछ रहे हैं, डू आई नीड सनस्क्रीन इफ आई एम नॉट वाइट? आई मीन ऐसा भी कोई डिफरेंशिएशन है कि वाइट स्किन में जरूरत है एंड व्हीटिश स्किन में नहीं है?
See, one thing, Palak, if your skin is wheatish, so you will get tanned more. So if your skin is white on the whiter side, you will get sunburns more. So both the skins have their own side effects. So sunscreen is made for each and every skin. Have you seen foreigners using sunscreen ऐसे beach पे लगाए रहे होते? So have you not wondered कि वो लोग क्यों लगा रहे हैं? Have you not seen Africans applying sunscreens? Because see, tanning तो होगा. We are not type 6, we are not type 1, we are type 4, type 5, okay? तो हम लोगों को sunscreen इसलिए necessary है, अगर हम लोग बाहर जा रहे हैं, even if you have whitish tone or you have little bit more on the darker side, you are more prone to get tanned. So use your sunscreen. Yes, you need to.
Nisha Jan is here asking a very interesting question. बहुत से लोगों के दिमाग में ये होता है, should we apply sunscreen on a cloudy day?
Yes, 100%. Even on a cloudy day, 80% of the sun rays are reaching your skin. So yes.
So the answer is yes, you need to apply sunscreen. You need to apply sunscreen regularly and you need to reapply it as well. No way out. Doctor, as we are coming to the concluding part of this session, anything that we missed out or anything that you want to share with our viewers, any takeaway message?
Just that, there's no escape from using your sunscreen. Basically, अगर आपको young दिखना है, अगर आपको aging को थोड़ा सा delay करना है, you want your skin to look glowy, and if you want कि नहीं, अभी हम लोगों को जितना 2-3 तिल है तो 2-3 से वो ऐसे 100 नहीं होने चाहिए, हमें दाग काला काला नहीं होना चाहिए, हमें टैनिंग नहीं होना चाहिए, you know. So use the sunscreens because as I said earlier, it is just a shield. It will protect you from the harmful sun rays, and we are living in India. It's too hot here in summer, so yes, you need to use your sunscreen.
Right. I think that was a very important message. And viewers, please, no excuse from not using sunscreen. Thank you so very much, Dr. Priya Agrawal, for your valuable time. It has been a very informative session for our viewers. It's great. It was great to hear you. We really look forward for many such sessions for our viewers in the coming time. Thank you so very much.
Same here. Thank you so much. It was nice connecting with you. Thank you.
It's always a pleasure. Thank you so very much once again. And if you want to consult with Dr. Priya Agrawal, you can reach out at support@priyaskinclinic.com, or directly you can call at 992-555-4102 or 777-90-17901. Monday to Saturday, 9 a.m. to 2 p.m., 5 p.m. to 8 p.m. Sunday close, of course. And for visit, the address is Umia House opposite Arogya Nagar near bus stand, Himat Nagar 383001, Gujarat, India. And please stay connected to our beautiful Spotless Skin page. Thank you. Have a good day ahead. Bye-bye.
Like, subscribe, and press the bell icon. Thanks for watching.